I'm gonna start with the screen share. Let's see if I can do this. Okay, I wanna hide that and start. Okay, all right, can you guys see? Can you see? Yeah, oh, yes. Okay, I thought I muted you for a second. Okay, yes. Good. All right, so welcome to-
I'm just gonna mute up because there's construction.
Got it, thank you, Michelle, okay. I was like, I can't hear them. So good morning, welcome to Healthy at Home. Today we're gonna talk about the hip. So you know me, most of you, because you guys have been here. My name is Dr. Melanie Carminati. And today I decided to do a different order. I'm gonna give the announcements first and then get into the stuff so that we just don't run through that. So let me just get to the bottom of that. Okay, here we are. So I should add in here that the last Healthy at Home is going to happen on, let me give you exact date, on May 29th. So from there, I'm still going to be doing Healthy at Homes. They just won't be live, and I'll be putting them on the YouTube channel. But we're transitioning to an Instagram live, YouTube live platform for the Instagram live event that I have coming up. So, but until May 29th, every Monday and Friday, 10:30, I'm going to continue doing this. We're going to get through most of the body, so it's going to be very extensive. We are continuing to offer the virtual Pilates beginner class. I teach that Tuesdays at 11, the intermediate class Wednesdays at 6, and I'm now offering a new promotion. So if you refer a friend, you get one class free. So if you know anyone, have any friends who would want to take a Pilates class, and they sign up and they pay for the class, you will get a class free. We are also continuing the PT evals, follow-ups, and Pilates one-on-one sessions. So last week I included the flyer. This webinar is available for disc herniations and scoliosis. If you're interested, just shoot us an email or you can sign up on the website. And then the thing that I'm most excited about is this Be Well Instagram Live series. So you can see the schedule of guests that I have. I am starting off on May 26th with Blossom Crawford. She is a second-generation Pilates instructor. We'll go into what that means during the Q&A, but she's just an innovator in the Pilates world, and she's here in Brooklyn, but she trained with one of the original students of Joseph Pilates. So she has access to information in a way, and the method in itself in a way that most of us don't. So she'll be just speaking about the evolution of Pilates with me. Then May 27th, Dr. Shaw Bronner, she will be answering some questions for me about safe return to dance after quarantine. Then June 2nd, Dr. Allison Triconde, she's a pelvic pain specialist, and I work with her treating some of her patients. We'll be speaking about pelvic pain. Catherine Fugelsang, she's an acupuncturist. We'll talk about mindfulness during quarantine. June 9th, Tracy Matthews, we're going to talk about fascia. Very exciting, interesting topic, because fascia is the connective tissue that covers our entire body, and it affects our movements, and it is important in rehabilitation to address it. Dr. Ben Taylor, he is an osteopath here in Brooklyn. Some of you may know him. His business is Brooklyn Osteopathy. We'll talk about some osteopathic tips on how to stay healthy at home. And then the series will finish with Kit Behun. She's also a Pilates instructor who is very creative and innovative, and we'll just talk about innovation and the transformative power of Pilates. So we got a lot that I'm going to be talking about. Just wanted to put it out there. All you have to do is follow us on Instagram at Inspira Physical Therapy, and the schedule will be there. And for most of these guests will be on Instagram Live. Just 2 of the guests will be doing on YouTube Live instead, because they don't actually have Instagram platforms. But yeah, stay tuned for that. So now that we got that out of the way, I'm gonna go back. Let's see. Okay, so I am bringing it back to today's topic, healthy at home, the hip. You know that this is just an educational virtual video chat. It is not meant to be in replace of skilled physical therapy. If you need skilled physical therapy, shoot us an email here or give us a call or text at that number. So this image is rather detailed, but I wanted to include the lumbar spine and the pelvis itself in the first introduction of the hip joint. So if you see over here, here's our femur. Here is what we call the femoral head. And then in this little divot part of our pelvis is the acetabulum. The acetabulum kind of looks like an ice cream scooper. So it's in the pelvis itself. There's a little divot that looks like what that ice cream scooper would look like. And then that circular ball of the femoral head goes right in there. Now, as you can see, there is a lot of nerve transference going on from the lumbosacral plexus, traveling through the pelvis and then innervating the leg and all of the muscles in the pelvis and the leg itself. So there's a lot going on here. I'm going to go to the next slide. So an important thing I wanted to point out too is that male and female pelvises, their anatomy is a little bit different. You can see that the female pelvis is wider and then the male pelvis is a little bit more narrow. As we can assume, the width of the female pelvis is to accommodate for childbirth and for the baby to pass through. But I like this image also because you can really see that acetabulum. So you can see that ice cream scooper there where the head of your femur goes. Now here's an up close shot of it with some muscles that we've already spoken about. So we spoke about with the core, the external oblique, internal oblique, transverse abdominis. I've shown you the layers when we did the core presentation, but then you can also see the neurovascular bundle, how it passes through this area and how close it is to the hip joint itself. Now this image this is a male pelvis. We know because they're showing us the internal spermatic fascia, right? So spermatic cord would only be present in a man. Okay, now getting into the hip joint a little bit more. So this is important bony anatomy. Bony anatomy, we have the greater trochanter. So this is looking at someone from behind. That little bony knob, if everyone takes their fingers and you put your fingers on the outside of your thigh and you just gently push, so not under the buttock, but on the outside of your thigh, you will eventually, if you work your fingers up towards the buttock area, you're gonna hit a little bony part, and that is your greater trochanter. If you turn your leg in and out, you can feel the greater trochanter pop in to your fingers and out. So the greater trochanter is important because many muscles insert on there to help allow us to turn out our leg and to stabilize the hips. As with all other joints, there's tons of ligaments that create a capsule that cover the joint. You can see here there's multiple, they're broken down into different names, but overall they make one capsule. Then there's also the lesser trochanter muscles insert there. I think the other thing that I wanted to point out with this image, because I know that there's a lot of names getting pointed out, but I wanted to show what the inside of the capsule looks like. So they took this, the femoral head out of the socket here. And so you can see what the socket looks like. You can see the labrum. The labrum is also present in our shoulder. It's a gel-like structure that allows for increased congruity of the joint. All that fancy wording means is that it allows for a better fit. It allows for a better fit of your femoral head in the hip socket. The reason you want a good fit in the hip joint is so that you can walk properly and that you won't have pain, and then you'll have the higher level of function. Also, let's see. I think that's enough for us. Okay, Moving on to some muscles. This is a back view. So back view, we can see the ever so famous piriformis muscle. So the piriformis muscle coursing right through here. It originates on the front of our sacrum. And as you can see in this image, we see the sciatic nerve coming out from underneath it. This is why many times people who have a tight piriformis or piriformis syndrome, as some people call it, may end up with sciatica-like symptoms. Now, the sciatic nerve, you can see it's a super big nerve. It goes all the way down the back of your thigh, and then just about above the knee joint, it splits into two separate nerves. So that's what our nerves do. They typically break off and create different branches, but it travels all the way down. And then the branch, the common peroneal nerve, is most commonly involved with when people have sciatica symptoms. That goes around the outside of your calf. So coming back up to the hip region, though, we can see they cut some of the glute max. They cut some of the gluteus medius. You can see all the gluteal muscles, the gluteus minimus, and then all of the deep rotators in your hip. These deep rotators that we worked last week, actually, when we were talking about the low back, they help to stabilize the hip itself. And then I guess what you can see here is just an appreciation of the bony anatomy and all of the muscles that insert. You can see these little strips, these little colors. There's multiple muscles that insert and originate on these bones. So let's see, one more. Nope. Okay, so hip diagnoses. Most of us have heard of osteoarthritis. That's very common in our hips. When we're bearing weight, both of our hips are typically involved. So having that wear and tear in our hips with degeneration is common. Leg calves perthes, that is a diagnosis that typically is given early in life, because there will be anatomical changes when a child is developing that are characteristic of it, but it has to do with a lack of blood supply to the hip itself. Femoral acetabular impingement, also known as FAI, that has to do with the shape of the femoral head and the socket itself being different, labral tear, femur fractures, trochanteric bursitis, all hip diagnoses. So what do we do in physical therapy for these hip conditions? First of all, we try to manage the pain, because whenever there's a hip condition, it typically can be rather uncomfortable. So either referring to a physician for medications, getting injections, ice, heat. Then therapeutic exercise-wise, commonly the stretching will involve hip flexor stretching, piriformis stretching. Strengthening is for the abductors. And then, of course, we spoke about the need to treat the lumbar spine whenever you're dealing with either when you're dealing with a hip condition. So we'll do core strengthening, posterior chain strengthening. And then in terms of neuromuscular reeducation, our hips are important for when we're standing, when we're walking, when we're squatting, and then for sport-specific retraining. Okay, so now I'm gonna stop the share, and we'll get into some movement. So we're going to start today on our stomachs. Of course, this is just a demo that I'm giving, and it is not specialized for one person or one diagnosis. So if you have a back condition that doesn't allow you to lay on your stomach, don't do it. But here we go. So we're gonna lay onto our stomachs, and you're gonna stack your hands one on top of the other. Your hands are gonna be stacked, and you're gonna rest your forehead on your hands. So I'm just gonna show you, but then I'm gonna continue looking at you so you can hear me. Okay, so we're on our stomachs with our forehead resting on our hands. Now we're gonna start with some posterior chain strengthening. What is our posterior chain? Our glutes and our hamstrings. So with our head on our forehead, you're going to bend your right knee to a 90-degree angle. You're going to flex the foot to a 90-degree angle. Then just hold this position here. Before you do any movement, you want to notice that both of your hip bones, the pelvis bones, are connected to the mat. So see if you can get the pelvis bones in the front evenly connected to the ground. Inhale. Exhale. Let's do a gentle abdominal engagement. And then you're going to lift that leg, lift the thigh up off the ground, just about an inch, and then lower back down. Do that 4 more times. Engage first in your abdominals before you lift the leg, and then lower back down. Again, up, and down, and up, down, and up, and down, and then lower the leg and rest. So you should have felt when you were lifting your glute muscle primarily, or some of the hamstring muscles. We'll do that on the other side. So you're going to bend the knee 90 degrees, flex the foot 90 degrees. Inhale through your nose. First, check in with your pelvic bones. Make sure the pelvic bones are on the ground, evenly connected. On the next exhale, you'll engage in the abdominals and then lift the left leg up to the ceiling. And then lower back down 4 times total. Up and down 3, 2 more, 2, and 1, and rest. Now, everyone's body's different, so there may have been an asymmetry in how your muscles worked there. For me, my right leg is stronger than my left. So what I felt when I was lifting with the left leg is my low back try to kick in. So that is something that in physical therapy we would address individually to correct that. So note that if you have those asymmetries, you want to work to balance it out. Next, hands are still stacked, forehead is down. You're going to keep the legs straight now. You're going to point your toes. You're going to hover the right leg up off the ground. And you're going to pulse up for a count of 10. Up and down, small pulses for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Other side, lengthen the left leg up, keep both pelvic bones connected. Hover at an inch and pulse up and down for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Great. We're going to roll onto our backs now. So we just warmed up the posterior chain. Normally in physical therapy, we would do 2 sets of 10 of that to start. But you're going to lay on your back. You're going to have your knees bent. Your feet are going to be flat on the ground. We're going to take our hands and you're going to place your hands on the tops of your thighs. Inhale through your nose. Exhale, engage in your abdominals. And then you're going to press your pelvis straight up to the ceiling. Your hands are going to press down into your thighs. Thighs press up into your hands and you're in a bridge. Hold this for 5, 4, 3, 2, 1. Lower down. Do that 3 more times. Inhale. Exhale. Press straight up. Hands press down into the thighs. Thighs press up into the hands. Hold it for 5, 4, 3, 2, 1, and down. Notice we're doing a straight spine bridge. This is safest if someone has osteoporosis or any back conditions to do a straight spine bridge. Inhale, exhale, press up. Hands press down into the thighs. Hold it for 5, 4, 3, 2, 1. One more time. Inhale. Exhale. Press straight up. Press those thighs up into your hands. Really have your feet active and awake during this for 5, 4, 3, 2, 1, and lower down. Okay, so that was all posterior chain, which is very important for our hips and for function. We're going to come lay onto our sides. We're going to have the legs, both legs straight. Top hand will come rest down in front of you. If you have a mat, use the mat as your reference. Remember, that's like a ruler. We're going to start by flexing both feet like you're standing on the ground. Then you're going to lift the top leg up to hip height. Bring that top leg back behind your hip about 1/2 inch. And then very slightly from the hip joint itself, externally rotate as if you're trying to turn your toes up to the ceiling. When you do that external rotation, you'll feel those buttock muscles and those deep rotators kick in. Keep the leg turned out like that, and now lift up and down for a count of 8. 8, 7, 6, 5, 4, 3, 2, 1. Go right into turning that foot back to parallel position. And now we'll do 10 small circles of that leg within the hip socket. 10 forward, 9, 8, 7, 6, 5, 4, 3, 2. Reverse it. Other way. 10, 9, 8, 7, 6, 5, 4, 3, 2, and relax. So you should be feeling some of those deep rotators and those gluteus medius muscles on that side working. These are important to stabilize our hips. Let's carefully come up to sitting, or you can just roll over to the other side, whatever you want to do. So go ahead and go over to the other side. Laying down, use the mat as a reference. Both legs are going to be straight to start. Okay. And use a moment or take a moment to align ears, shoulders, and hips. Top hand goes down in front of you. We're going to hover the top leg up off the bottom leg. Make sure both feet are flexed. Bring that leg an inch behind your hip. Externally rotate so that the toes turn up to the ceiling, and we'll lift up and down for a count of 8. 8, 7, 6, 5, 4, 3, 2, and 1. Now turn the toes to face forward. Do 10 small circles of the leg within the hip socket. 10, 9, 8, 7, 6, 5, 4, 3, 2. Reverse the circle. Try to be precise with the circle and only circle the femur in the hip socket. 8, 7, 6, 5, 4, 3, 2, and 1. Relax. Okay, let's carefully come up to standing. So the big difference between what I'm doing here with the Healthy at Home and my virtual classes is that for the virtual classes, I'm actually sitting, watching everyone, calling out people's names and correcting them. So if you've ever done a one-on-one session with me, you probably already know that, but just a heads up, if you're looking for more corrections, that happens in the group classes. So you're gonna stand up, and we're just gonna take a moment to feel our hip, those pelvic bones in the front. So if you take your fingertips and put them on your pelvis in the front, find those bony prominences and try to get those bony prominences to point straight forward like headlights of a car, okay? Now from here, I want you just to shift your weight over to your right leg and then just hover the left leg up off the ground and notice if those hip bones change at all. Shift over to the left, hover the right leg, same thing. Okay, now here's a challenge. If you can, use your abdominals, use your core, use those hip muscles we just warmed up to keep the hip bones at the same level when you shift the weight. So that is going to require some glute strength, some core strength. Good. Switch to the other side. And down. Okie dokie. Let's come back to sitting. Okay, so the hips can be complex when you're understanding the anatomy, but the exercises are pretty straightforward. You want to have a certain amount of strength and stability, but also have a certain amount of flexibility, which we're going to get into flexibility on Friday. So today was all strengthening exercises for the posterior chain, your glutes, your hamstrings, and then that finishing exercise was just pulling it all together. You're using those muscles every day when you're walking, when you're standing, to keep the pelvis level. So having them strong is super important for any functional activity, but it's also important if you have any low back issue too. because the pelvis and the hips need to be stable in order for your lumbar spine to be supported. So I already did all of the announcements in the beginning. So now we just have a few minutes for questions and answers.
Questions, any? No. We're good. Thank you.
You're good?
Yes.
Okay.
I'll probably reach out to you, the exercises that you gave me on our one-on-one last week. I'll probably, reach out so that you can check and make sure I'm doing them properly. So I'll reach out to you in a few days.
Okay, sounds good.
Thank you.
Jeannie?
Yeah, I have a question about the lying flat and the perpendicular lift. And this one, if it was like very uneven, the ability to lift one side versus the other, but as long as the intention is there.
We can work on that one. We can work on that one-on-one. Yeah, so it takes a lot of correction because most of us walk with some amount of turn out or turn in or a whole bunch of variations in our leg. So when you do it to get both pelvic bones touching the ground while you're doing it, you have to have the bones in a certain alignment. So if you turn out at all on one foot when you're standing, it's going to be hard to do that with the knee bent in a 90-degree angle.
Yeah, because it felt like I didn't know if there was a certain amount of torque where the hip bones weren't, like if I wasn't lying completely flat, or if that's just that there's a shift in the spine, therefore there's a shift in the hip bones.
Yeah, let's go over that. Exactly. Let's go over that tomorrow during the one-on-one. Michelle, any questions?
I am all good.
Okay, great. Yeah, it is complex. Like even the anatomy in the beginning that we were going over, the hips are complex, right? Because there's a bunch of things. We got the pelvis, we got the lumbar spine, we got the femurs. And so there's a lot of coordination. Those exercises were just a introduction to how we strengthen and stabilize our hips. So, but if you have either a hip or lumbar issue or both, you're definitely going to need some one-on-one guidance.
Right.
But we'll go over it tomorrow. Okay, ladies, have a beautiful Monday, and I'll see you soon. I'll see you Friday, hopefully.
See you then.
Bye-bye.
Bye.